The way that babies and young children under the age of 3 use a pump is with a spacer and a mask. The mask is needed because the little ones cannot close their mouths over the spacer mouthpiece. Children should be switched from a face mask to mouthpiece as soon as they are able to form a seal around the spacer with their mouth. With the help of the HuffPuff kit, a child can inhale a complete dose of medicine while breathing normally. The shape of the baby mask provides a comfortable, snug fit over a child's face. The exhalation vent provides an outlet for the exhaled air and makes breathing easier. Once the spacer has been assembled, follow the next steps. Step 1. Shake the inhaler. Remove the mouthpiece cap from the inhaler. Step 2. Insert the mouthpiece of the inhaler into the spacer. Step 3. Sit or lay the child on your lap. Hold the HuffPuff kit firmly over the mouth and nose of the child, ensuring that the exhalation vent fits over the nose. Step 4. Holding the inhaler, press down on the canister to release a dose into the spacer. You will see the dose released into the spacer. Hold the HuffPuff kit in place for 60 seconds while the child breathes in and out normally, thus inhaling the medicine. If a second dose is required, wait for a minute. Remove the inhaler, shake well, then repeat steps 2 to 4. Step 5. Remove the inhaler from the HuffPuff kit and replace the mouthpiece cap on the inhaler. When using an inhaler with a spacer and mask, always wipe the child's face and rinse the mouth with water to prevent the child from developing a fungal infection. Let's see steps 1 to 5 one more time. Remember to bring your pump with to every single visit, so you can demonstrate it again and again to fine-tune any problems.